Global Health Solutions. Thank you so much. Today happens to be the last day of August 2021. And on this very last day, we're going to have a kind of ground wardrobe. Do measure, please reduce your volume on now. So today we're going to have an opportunity to touch base and review our journey for the month of August. So in the next probably 30 minutes or thereabout, we'll have an opportunity to touch base. So it's pretty much going to be open. So we're going to take stock for the month of August. So we're going to look at our objectives. We're going to look at our SMART goals, things we set out to do for the month of August. So we're going to look at where we started and where we are currently. So I want each and every one of you, when you join this clinic this afternoon, ask yourself some simple questions. Are you there yet? Are you currently pregnant? Do you have a failed pregnancy trial? What's your game plan? Do measure, especially as we are getting ready to enter September. The month of September is always a reminder that we have just few months to end any particular year. 2021 has been challenging, but we survived 2020. 2021 cannot be compared to 2020. 2021, it's much better than 2020. So if you survived up to September, thank God. Now, what we're going to do today is to quickly rally. So when you come in, tell me your name. Let me know where you're located. Then as soon as possible, please start asking your questions. I want us to take individual stock. It's possible there are so many things you had wanted to do for the month of August, you couldn't do them. And you haven't been in a good place. You're kind of, regretting, or you're not happy, or you're sad, or you're depressed. It's okay. It's okay to feel bad because your period showed up. Remember, for the month of August, you only have one opportunity to become pregnant. If you miss becoming pregnant in the month of August, September is your month. Remember, for the month of September, you also have one opportunity. When you miss your opportunity to become pregnant in September, you will have another opportunity in October. You will have another opportunity in November. You have another opportunity in December. So we still have September, October, November, December, 4 opportunities. And it's my earnest prayer as we are ending August today. August was very challenging for everybody, including my organization. So many tragedies, so many negatives. People couldn't really get what they need. People don't have the resources. Doctors are on strike. You're depressed. You're adding weight. You don't have money. So many complaints. But top on the list is the ability to appreciate the little things. So if you are hearing my voice today, you are blessed. So even when you didn't succeed, the ability of you to recognize that God gave you another opportunity is a reminder that you're going to make it. So this is what I know. So many of our members are going to succeed in the month of September. September is going to be a September to remember. In 9 months, September signifies the number 9. Number 9 is the average month you will carry your pregnancy. So in 9 months' time, so many of our members are going to be mothers of single baby, twins, triplets, quadruplets. It will happen in this group. Now, what we're going to do is to ask ourselves simple question. Do I have the right tools to achieve my objectives? Am I praying enough? Am I playing enough? Do I practice everything we learn from this group? The singular tool that will get you pregnant, the singular tool that will make you a mother, the singular tool that will make you to meet your objectives, which you've set out for the upcoming month, is what? Triple P. You have to pray to God every single second. Now, when you have said your prayer, also make love 48 hourly. Now, when you're making love, it's important you fall in love with your love making. Because you're going to make love frequently, every 48 hours. If you don't fall in love with your love making, it's going to be tasking, it's going to be laborious. You will not like it. So if you don't know how to make love, please gain experience. We can help you. Now, just to start today's grand word round, it's possible we might exceed 30 minutes. My driving factor is going to be the number of questions I have. So once you've announced your location, start asking your questions. Focus on my admin. We have a full house. Dr. Ndiche is in the house. The COO is in the house. Chinyere is in the house. Onyinye is in the house. And Ebenezer is in the house. So we have a full house. So you will not lack anything. So let's tackle the questions. Now, remember, if you're in YouTube, you can join us. If you're in my private timeline, you can join us. If you're in our page, you can join us. If you are in our group, you can join us. So it doesn't matter where you are. You can ask your questions in real time. Elizabeth Omor Jiva from YouTube, thank you so much for coming. So guys, let's quickly tackle the questions. So let's see what we have. So start asking your questions. The clinic is open. And I'm going to provide you feedbacks and also focus on Dr. Ndiche. Dr. Ndiche will also provide feedbacks. Okay, so guys, let's go. So let's remind ourselves of what we need to do. Okay, let's remind ourselves of what we need to do. Triple P, pray always, play every 48 hours, and practice everything you learn. So if you made love yesterday, you can have a break today. Then tomorrow you continue. Then you have a break on Thursday. Then Friday you continue. Then Saturday you have a break. This is what I want you to do. 48 hourly. This is my prescription. It works. So go and try it, okay? The time you will use to complain, the time you will use to go and seek for pity, you can use it to make love, okay? Guys, also, if you are in any of these locations, Abuja, Asaba, Awka, Benue, Calabar, Enugu, Jos, Kanu, Kogi, Lagos, Nnewi, Osun, Owerri, and Port Harcourt, we have certified, verified, evidence-based fertility specialists we can refer you to. You can get help from them. Now, if you want to come in to consult with me, it's possible, but you need to subscribe. You can come in for 1 week. You can come in for 1 month. You can come in for 3 months. You can come in for 6 months. Now, if you are already pregnant, that's not the end of the discussion. The end of discussion in pregnancy is the ability to deliver the placenta. Once your placenta is delivered and you have your baby in your hand, you have succeeded. So all members of our group who are pregnant, especially in the prevailing environment of Nigeria when so many doctors are on strike, please and please protect your family, insure your family. Admin, please capture this for me. All pregnant women, regardless of how long you had your pregnancy, regardless of if it's urine test, blood test, or ultrasound, register for your ANC immediately. Every singular pregnant woman must, by default, have a urine test, blood test, and ultrasound. Once that ultrasound shows the evidence that you're pregnant, then please and please register for your ultrasound. Register for your ANC. There is no debate about that. You cannot avoid it. It's mandatory. All pregnant women must register for ANC on ground. Now, if you also want to register for our own ANC, we have a special group of pregnant women where we converge every single day, and you have opportunity to feedback, to ask your questions, and you get feedback, okay? So those are the few questions and a few updates, but right now, let's take care of your questions. So I'm gonna search for, okay, let's see. Okay, you're in Lagos, please refer you to a good hospital for fertility checkup. Follow the admin, subscribe. You can come in for 1 week, 1 month, 3 months, 6 months. When you're subscribed, we can refer you. We don't refer everybody. We refer only subscribers. Okay, let's continue, guys. Please keep asking your questions. Admin, you can also post any question I haven't provided feedbacks on, so I can provide feedbacks. This is Grand Word Round. Grand Word Round means everybody is welcomed. Okay? What causes period not to flow, but it's regular? Now, I'm trying to understand what you mean not to flow, but it's regular. Now, the normal period lasts from 2 days to 7 days. Okay? Now you know your normal. So you know if it's heavy, if it's moderate, if it's light. If your normal is still normal, no problem. But if suddenly you notice that you are bleeding heavy, it's coming beyond 7 days, you are having pain, which you were not previously having, it's possible you might have gynecological problems. It might be endometriosis, it might be fibroid, it can be other gynecological problems. So what you need to do is to see a gynecologist. What causes milk to be coming out from your breast when you press your breast and you're not pregnant? The likelihood your prolactin level is very high. When your prolactin level is high, prolactin is a hormone that should go up when you're pregnant or when you're breastfeeding. Now, when you're not pregnant and your prolactin level goes up, that condition is called hyperprolactinemia. When your prolactin level goes up, it's going to change your whole cycle. And one of the areas it will manifest is the inability for you to ovulate. So high prolactin level will affect the other hormones. And when you don't ovulate, you cannot become pregnant, because ovulation simply means you're going to release your eggs. So if you don't release the eggs you have, the sperm cannot meet it, you're not going to be pregnant. Now, thankfully, when your prolactin level is high, there are specific drugs we can give you. So what you need to do, if you notice that you have any discharge from your breast, maybe in cause of lovemaking, or you intentionally noticed it by yourself, ring your doctor. When you get to your doctor, we're going to collect your blood sample, check the level of prolactin. If it's confirmed it's high, we'll give you specific drugs. Now, if your prolactin is the only problem you have, when we correct your prolactin, you can become pregnant. So high prolactin is a known cause of temporal delay in your ability to become pregnant. But thankfully, once we identify that, we can fix that and you can become pregnant. Very, very important. Okay, let's continue, guys. Let's continue. Please keep asking your questions. If you're in YouTube, thank you so much for coming. Remember to subscribe. Remember to click on the notification so that anytime I come live, you can easily identify with all the videos, okay? You put to bed in January this year. You've seen your period this August. You are still breastfeeding. Hope is normal, completely normal. Now, the factors that will lead to your ability to see your period early or later is dependent on the type of feeding you're giving your baby. If you give your baby exclusive breastfeeding, your period is going to be delayed before it comes back. The reason is because we have something we call lactational amenorrhea. So the hormones, of which prolactin is one of them, when you are breastfeeding your baby regularly, you will have a makeshift contraceptive, protection. So supposedly, when you are breastfeeding, those breastfeeding hormones will block the other hormones that will lead to ovulation. Like I mentioned, high prolactin level will lead to escape of breast milk in your breast when you're not pregnant. In the same vein, when you're a new mother, expectedly, when you are giving only breast milk, which means exclusive breastfeeding, if you do 6 months exclusive breastfeeding, which is what we actually preach. So if you can, give your baby only breast milk. When we mean exclusive breastfeeding, we mean exclusive. You don't need water. You don't need anything because your breast contains water. Your breast milk contains every single thing your baby needs. If you can adopt this for 6 months, your baby will be perfect. Now, some women can quickly have return of their period. Some women, it might be 3 months. Some women, it might be 6 months. It depends on how your body responds. But here's the deal. This form of contraception is very, very weak. It's passive. So some women can actually ovulate even before they bleed. So by default, the practice of waiting for your period to come back before you start using protection if you're meeting with your partner, it's not good. Especially if you're younger than 35, you can quickly become pregnant again, even when your baby is 3 months. So one of the advice we normally give women before they go home after delivery is to use protection. If your partner continues to make love to you, even when your period hasn't returned, you can ovulate and you can become pregnant as soon as 3 months after childbirth. Now, it doesn't make sense to have a little baby and you're pregnant again. It doesn't make sense. It's actually a selfish thing because you're not going to look after the young baby, then you're not going to look after the baby you have in your belly. Every singular pregnant woman, when you give birth to your baby, allow 18 months. Listen to me carefully. Allow 18 months to elapse before you think of becoming pregnant and having another baby. When you allow 18 months to pass, you are giving yourself an opportunity. You're giving your body an opportunity. You're giving your womb an opportunity. You're giving every singular thing you lost, because when you become pregnant and when you have your baby, there are so many things that leave your body. You are so depleted. So when you quickly go back to become pregnant over and over again without recovery, you're putting your womb in danger. You're putting your life in danger. We've had women that had disability. We have women that actually died. So allow 18 months. Now, I understand some women might be 40, 41, 45, and they want to quickly start their family. If you are in this category, meet with your provider. But generally, once you've had your baby, allow yourself recovery before you go again. Now, if your partner is making love to you without protection, shortly after childbirth, you can become pregnant. So the practice of waiting for your period to come back, then you begin to be careful, doesn't apply. You can become pregnant, especially if you're below 35. So the younger you are, the likelihood you're going to become pregnant. All pregnancies must be planned. Pregnancy is not something that happens by chance. By default, allow at least 2 years between your babies. When you space your family, your baby is going to enjoy you. You're going to enjoy your baby before you bring forth any other baby. Very important. Now, this is what I know. Some of our members that have been having infertility for a long time, 20 years, 15 years, 10 years, 5 years, guess what? Our God is able to complete your family in one sweep. Our God is more than capable to justify your IVF. So today I'll be talking about IVF cost in Nigeria. So if you don't know the exact cost of IVF in Nigeria, tune in today by 7 p.m. Eastern time, my time, which probably should be your 12 a.m. I apologize because that's about the only time I have a time. But this is the deal. Some of our members are going to step up to go for IVF, especially if you're above 35. Guess what? You can go for IVF the first time and you can have twins. You can go for IVF the first time, you can have triplets. You can go for IVF the first time and you can have 4 babies. So guess what? If you had wanted to have 2 babies, 3 babies, 4 babies, and you were not able to have them 15 years ago, you've been trying 10 years ago, you can complete your family in 2022. Do you understand that? God is an amazing God. And when I tell you this, I'm not just telling you this so make you feel good. I have seen God change people's situation. I have seen God change a particular family from a crying family to a rejoicing family. It has happened all over the world. I have seen God give a family that the lady had only 1 tube, borrowed money for failed IVF. They went back for another IVF and they have 4 babies today. 2 boys and 2 girls. It has happened before. It is not a joke. I have seen women that went into menopause. They took their bold steps. They are mothers today. So regardless of where you found yourself, as we are taking stock today, the theme for my clinic today is taking stock. Evaluate your journey. You wanted to start your family in January, right? You wrote a lot of lists, bucket list, New Year resolutions. Have you gone back to them? How many of them have you accomplished? You wanted to become pregnant in 2021. Have you succeeded in becoming pregnant? What are you doing about it? Do you have a fertility specialist? Have we identified what the problem is? What is your game plan? Are you only crying about it? When you are done crying, what have you done differently? Are you guys on the same page? Are you on plan A and your partner is on plan C? For us to succeed, we have to work as a team. Okay, so let's continue the questions. Okay. Keep asking your questions. Dr. Ndiche is in the house. Okay, let's see. Your cycle is between 26 to 30 days. That's completely normal. The normal cycle is 21 to 35 days. So in your own case, 26 to 30 days is completely normal. Okay? All right. And once you begin to go into 41 days, it becomes abnormal. You had painful, heavy breast, spotting, went for scan. It shows sciasis. So sciasis means you were pregnant. Okay, thick uterine lining, the same day you had heavy period for a day. What's the cause? Now the question is, have you checked the status of your pregnancy? You mentioned you have sciasis. Anytime you go for scan and you see sciasis, sciasis means you are pregnant. Now in your own case, have you confirmed the status of your pregnancy? If you are spotting in pregnancy, is a concern. That spotting might be implantation bleeding. That spotting might be dehydration. That spotting might be hormone imbalance. That spotting might be infection. What do you need to do? You see your doctor immediately. So anytime in your pregnancy you spot, you need to call your doctor. You need to go in for checks. Now, my sister, what you need now is to be in our ANC lounge. And if you haven't seen a doctor, please go and see a doctor. You see, when you are pregnant, there is no assumption, because by the time you are assuming, 24 hours is a long time in pregnancy. So you might be waiting for daybreak to go to the hospital. By the time you wake up, you've actually had miscarriage. So there is no time to wait in pregnancy. There are 3 things that will shock you in your pregnancy. When you see blood, when you see water coming out of your body, and when you feel pain. Blood, water, pain, they are signs that your pregnancy is challenged. So anytime in your pregnancy you bleed, there are 3 S's you need to observe. Immediately discontinue sex. Immediately. Don't go for any sports, and don't stress. So let me repeat again. If you are pregnant, how do you know you're pregnant? You go for your urine test. When you're going for your urine test, we are running a special test we call beta SCG, beta human chorionic gonadotropin. We can also do a blood test. When we are doing a blood test, we are also checking for the so-called beta HCG, the human chorionic gonadotropin, the so-called pregnancy hormone. When you are done with a positive result in your blood, you go for ultrasound. When we confirm that you're pregnant and the pregnancy is viable, so viability of pregnancy means it's developing inside the womb. Unfortunately, some women can be pregnant, but the pregnancy is not viable. So what are the examples of non-viable pregnancy? Number 1, blighted ovum. Blighted ovum means we went for ultrasound, we saw an empty sac. Some people can have chemical pregnancy. Some people can have molar pregnancy. Some people can have ectopic pregnancy. In ectopic pregnancy, the pregnancy is developing elsewhere, like in the tube. The commonest place you can have ectopic pregnancy is in the tube. Unfortunately, when you have any of this type of pregnancy I mentioned, they are not viable. So non-viable means that pregnancy will not survive, right? But if your pregnancy is confirmed to be okay, register for ANC immediately. Some women will be asked to be on bed rest. Some women will be asked to take some drugs. We can prescribe progesterone for you. Women that are prone to having miscarriage, when we check their progesterone level, when the progesterone level is low, we give them pregnancy support with progesterone. It's very important. Okay, so don't take matters into your hands, okay? Let's continue, guys. Let's continue. Okay, let's see this one. When your menses is more than 41 days, it's completely abnormal. Once you've gone above 35, it's irregular. You have to see your doctor immediately. And you have taken all manner of drugs, from clomiphene and metformin, glucophage. So by default, the drugs you've mentioned right now means you have either 2 of these conditions. It's either you have diabetes or you have PCOS, polycystic ovarian syndrome. Now listen to me carefully. You know, it's very easy for us to believe in our own ways, to lean on our own understanding. Now you've already shown some, frustration, which is okay. Now, have we looked at your partner? Remember that it takes 2 to tango, right? So we need to look at the man. We also need to look at the women. Now, in your own case, you've taken Clomid, You've taken clomiphene and you've taken metformin and glucophage. Metformin and glucophage are drugs we use in managing diabetes, but I'm suspecting you have polycystic ovarian syndrome. So the question is, do you have a game plan? Do you have a fertility specialist who is following you up? What about your lifestyle? Are you exercising? What is your BMI? Are you stressed? You cannot give up. When you try and you didn't succeed, you can cry, but you get up and you keep trying. So what you need, blessing, it's a fertility specialist, number one. Then an endocrinologist, because if you have polycystic ovarian syndrome, it's a continuous management. Unfortunately, you're going to live with it with your life, right? But there are so many women that have PCOS that have babies, but you need to be followed up by a specialist. This is not something you'll just sit back and you'll be imagining or you'll be speculating. There is no speculation in fertility treatment. Okay, let's continue, guys. So you need help. So I will advise you to subscribe and we can set you up. All right, guys, keep asking your questions. Okay, if your urine test shows it's negative, then likelihood you're not pregnant. Now, what you need to do is to allow enough time. The best time to check for your pregnancy test is 7 days beyond when you're expecting your period. So if you're expecting your period tomorrow, I don't expect you to check on Thursday for pregnancy. It's too early. Allow 7 days before you check. Now, if you check your urine test and you're not pregnant, it's possible you're not pregnant, right? Don't go start freaking out. You can check 2 days afterwards. If it's still not pregnant, if it's still not positive, then likelihood you're not pregnant. But you are expected to check your blood test when you're done with your urine test. When you're done with your blood test, you go for ultrasound. They are the 3 important and must tests you have to run if you are pregnant. You cannot avoid any of the 3. Okay, let's continue, guys. Let's see what we have. Keep asking your questions, please. Remember, it's grad word round, so I'm going to provide feedbacks to everybody's question. And Dr. Ndiche is also supporting me from background. You notice this awful heavy discharge after your supposed window period since March. From series of tests you've done, no infection. Now, here's the deal. You are not supposed to have an awful smelling discharge. Anytime you have a smelly discharge, colored discharge, copious discharge, itchy discharge, there's a problem. It might be an allergy, it might be an infection, it might be a couple of other gynecological problems. So it's not normal. Your discharge is not supposed to smell. The body of a woman is not supposed to smell. Your vagina is not supposed to smell. Why? Your vagina knows how to clean itself. So every woman discharges. If you pay attention to your body, you will notice that you discharge virtually every day. That discharge is the way of the vagina to clean itself. But when you begin to have foul-smelling discharge, colored discharge, bloody, green, yellow, brown, all the shades of colors, there is a problem. Go to a gynecologist. So if you haven't gone to a gynecologist, please better go now, okay? All right, let's continue, guys. Let's continue. If you want to subscribe, please subscribe, okay? You have an opportunity. You can actually start your September on a high note. You can come in for 6 months. When you're coming in for 6 months, you have an advantage. Advantage is that you can talk to me one-on-one. So we can have a scheduled call. I can talk to you. I can talk to your partner. And by the time you spend 6 months with me, look, I'm not someone that boasts, okay? I just keep it real. There is absolutely no way you will spend 6 months with me and you follow your PPP and you won't be a mother next year. You can quote me anytime. If you play your part and I play my part and God steps in, you're going to be a mother. There is absolutely nothing that will stop you. Why? There are so many things you might not be doing right. The problem might be your man. The problem might be you. You guys might not even understand what's going on. So I dare you to come in for 6 months, for 3 months. So only 6 months and 3 months will give you the talking opportunity. If you're 1 month or 1 week, you can only chat with me and we can get things sorted out. Can a woman that gets to 45 years get pregnant naturally? Yes. Now, this is what I will tell you, my sister. Until you've gone into menopause, you can become pregnant naturally. Now, some women can go into menopause before 40. Most women will go into menopause towards 50. But here is what I know. The most important factor in determining if you're going to become pregnant is what we call ovarian reserve. Now, my sister, at 45, chances are that you have grossly reduce your ovarian reserve. So your number of eggs might be down and the quality might be down. Now, your ability to become pregnant naturally, it's based on the frequency of your partner making love to you and the availability of eggs. So if at 45, you released an egg during your ovulation and your partner makes love to you, you can become pregnant naturally. But this is also what I know. If you have been looking for a baby since and you don't have a baby and you are currently 45, waiting for natural process is not your best method. Because if natural problem is the issue, you would have become pregnant a long time. So what do we tell women in their 40s? Yield to professional advice. First of all, you can't do this alone. You need a fertility specialist. When you get to the fertility specialist, listen to the instructions, follow the options. Some of you might be prescribed some fertility drugs. Some of you might be prescribed IUI or artificial insemination, IVF, surrogacy, adoption. They are all okay. Now, if you are going for IVF, age 40 and above, we normally advise you to go for donor eggs. Why? The success of your IVF is dependent on the quality of the eggs and the sperm. Now, for most women, there are differences, so don't go and misquote me. There are women that became pregnant naturally at 50. It's their chance. There are women that can become pregnant at 51. It's their chance. It's rare. So long as you have eggs, you can become pregnant. But your best chance is to go for assisted reproductive technique. So my sister at 45, if you were to be my sister, which you're my sister, anybody in this group is my sister, I consider you guys my family. Now, what I will tell you, my sister, at 45, after this clinic, immediately you go and subscribe. We'll refer you to a fertility specialist with your partner. When your partner gets there, we need to look at the sperm. We need to check your fertility assessment yourself. If we discover what the problem is, we can begin to tackle it. But your best chance, as I'm talking to you right now, of becoming a mother in 2022 is not natural method. It's ART. It's IVF with donor eggs. You know, one thing I will give you in this group is my truth. Sometimes you might not like it, but if you follow it, you're going to get results. So that's what you need, my sister Priscilla. Okay? Guys, let's continue. Let's continue. Okay. You've done prolactin test. It's not high, but you still see discharge. So some women can still be discharging when their prolactin level is normal. So our major concern when it comes to becoming pregnant is the level of prolactin. So long as your prolactin level is not high, we are okay with that. So don't worry about it. Okay? Can Depo-Provera stop your period completely? Well, it depends on your body mechanisms. Depo-Provera is a type of hormonal-based drugs which we can also use for contraceptive purposes. So anytime you're taking any hormonal-related drugs, it can actually alter your cycle. Some women can have missed period for some time, and some women can also have cessation of their period. So the answer is yes. This can also apply to your Clomid and your Postinol. So whenever you take your Postinol, which you're not supposed to be taking after every sexual encounter, your Postinol is an emergency contraceptive. But when you take it regularly, it can disrupt your cycle. So some women can notice absence of their period or increased bleeding or light bleeding. Every woman responds differently. But this is what you should do. Your Postinol is not something you take like water. You are supposed to take it as an emergency contraceptive. Emergency contraceptive means probably you forgot to use condom or you forgot your pills. And, you know, within 5 days of making love without protection, you can take your Postinol and you can prevent pregnancy. But it's not a contraceptive you use every day. Okay, let's continue, guys. Okay, this question is from YouTube. I love that. Okay, doc, is aspirin safe in pregnancy? Yes, my sister. Some women will be prescribed aspirin specifically in pregnancy if they have a need for that. Now, aspirin is a protective drug for a couple of medical complications. So aspirin, it's not for every pregnant woman, but aspirin might help some women in pregnancy to avoid complications. So the answer is what? Yes. If your doctor felt a need to give you aspirin, especially if you have histories of previous miscarriages, take that aspirin religiously. Okay, let's continue, guys. Let's continue. Let's continue. Keep asking your questions. Admin, please keep reposting all the questions I and Dr. Ndiche haven't provided feedback on, okay? All right, so I'm going up. Doc, you can start coming from down so we can meet elsewhere. Okay. What's the cause for early ovarian cyst? So most ovarian cysts are called functional cysts. They will not affect your ability to become pregnant. Now, there are fewer cysts that might reduce your ability to become pregnant. Now, there are also some cysts that might need to surgical removal. Depending on your own case, go see your doctor, and your doctor will tell you the right thing to do. Okay, guys, let's continue. Keep asking your questions. Keep asking your questions because it's a grand word round. We're going to push a little more. By now, my time would have been up, but I'm going to give more opportunities to make sure that everybody's question is attended to. It's the last day of the month, so we want to make sure that everybody is happy. So, guys, keep asking your questions. If you need to subscribe, follow the admin. If you missed the ovulation bootcamp, I can tell you categorically now that you missed a lot of good things. Now, if you were not able to afford attending, by the time the PDF is out, you can have a 50% discount. So be on the lookout for the PDF. See, my people, if you are not ovulating, you cannot become pregnant. So a good knowledge of ovulation is important for you to become pregnant. Okay? All right, let's continue, guys. Okay, I'm going to mention this lady from Zimbabwe, Polite Machinga Masuka, a dedicated, staunch member from Zimbabwe. When this lady showed up a couple of years ago, she didn't have any hopes. She was so freaking out. She couldn't subscribe, but she followed up every single clinic she was attending. By the grace of God, I shared her testimony before I started my clinic. She's a mother today. So you see, our group is not a Nigerian group. My voice is not a Nigerian voice. I only happen to have an advantage. I'm a Nigerian. So it doesn't matter where you live. If you can follow my instruction, if you can pray and practice and play, you'll become a mother. So Polite, thank you so much for keeping faith and keep spreading the good news in Harare, Zimbabwe, okay? God bless you. Okay, let's continue, guys. Keep asking your questions, please. Okay? Okay. Can a woman of almost 60 years have ovarian cyst? Any woman can have cyst at any time. Okay, but here is what we know. At 60, the size of your ovaries by default will start shrinking. At 60, the likelihood you've gone into menopause is very high. Now, my concern at 60 is not cyst. Cyst should be the last thing on my mind. So I'm not worried about this. But any woman can develop cyst at any stage, okay? So at 60, you should go and see your gynecologist, and we have a definitive diagnosis. Very important, okay? All right. Let's see what we have. What can cause still not getting pregnant after doing HSG and hysteroscope? So the fact you've done hysterosalpingogram and hysteroscope doesn't mean you're going to get pregnant by default. They are all diagnostic tests. Your HSG is looking at your tubes. Your hysteroscope is looking at your womb. So they are all just diagnoses. It's not that once you do your HSG and hysteroscope, you will become pregnant. So what you need to do is to take your partner and yourself to a fertility specialist. There are so many things that can cause problem for you. There are so many things that can cause problem for your person, for your man. So you need to go and seek further help. Don't be that lady that will just believe the problem is coming from you when you haven't even told your partner. We need to follow due process. There are due processes you have to follow in fertility management. Unfortunately, it's expensive. We've had so many people that got sponsored, that came in, they were able to get consult, but they couldn't go for their test. Unfortunately, it's expensive. Let me tell you why your test is very important. Fertility treatment is expensive. It's not a blind protocol. Before we even begin to give you drugs, we have to have your baseline. So I have to have your hormones. I have to know the state of your womb. I have to know the state of your tubes. I have to know the seminal fluid analysis of your partner. In Nigeria, approximately 100,000 naira is what you need to have those tests ready. Now, you might not have the money, but guess what? Even when you don't have money, continue making love. There are so many people that might be looking for money for consult, for IVF, for IUI, and before you blink, they are pregnant. God is still God. But increase your opportunity of getting help if you're going for fertility treatment by doing those tests. They are important, okay? Let's continue, guys. Okay. Apart from myomectomy, is there any method of treating submucosal fibroid? Now, the treatment of your fibroid with surgery is dependent on the size and location. So if this submucosal fibroid is bigger than 6 cm and is giving you a lot of symptoms and you want to become pregnant, definitely myomectomy is your only chance. But if your fibroid is just there, not giving you symptoms, not bigger than 6 cm, you can leave it alone. So myomectomy is only indicated if it's big, if it's inside, if it's causing you symptoms, and you want to become pregnant. The reason is because two types of fibroid is actually inside the cavity of your womb: intramural fibroid and submucosal fibroid. And these two types of fibroid are in the place your baby should be developing. They are in the place implantation is supposed to happen. So sometimes, if they are too big, they will prevent pregnancy from happening, and they can cause miscarriage. So follow your doctor. Your doctor will define your fibroid. So any woman they tell she has fibroid, it's not just enough to tell a woman she has fibroid. We need to know the type. We need to know the size. Then we need to know about the symptoms. You have to know this. The size, the location, and the symptoms will determine if you're going to go for surgery. There are some women that will have fibroid. They won't even know they have fibroid. They will complete their whole family. Thankfully, as you're getting older, your fibroid will start shrinking because your fibroid responds to hormones, especially estrogen, okay? But follow your doctor. If your doctor recommended myomectomy, please do it early. We've had women that wasted time. By the time they came back, we have to do hysterectomy. Some fibroids can damage your womb to the extent we have to remove the womb. Some fibroids can damage your tube. So don't waste time. If your fibroid is symptomatic and big, we need to remove it. Okay, let's continue, guys. If your questions are not answered, please ask again. I'll provide you feedback before I go. Okay? What's the purpose of M2 tone? It's a form of progesterone, okay? So if your progesterone level is not within the normal range, they can prescribe that for you. Okay? What's next? What should be done to correct your cycle? You want to conceive this year, you need a fertility specialist. So it's just not enough to want to. You have to take a bold step. So if you want to, the problem might not just be your cycle. We need to look at the totality of your fertility assessment, look at your partner, then decide what the problem is. Now, unfortunately, majority of women want to. Majority of women are saying amen, but they're not doing the right things. There are some women that want to become pregnant, but they're not making love. My sister, you cannot become pregnant if you don't make love to your partner for 48 hours, especially if you're above 35. Unfortunately, above 35, you no longer love lovemaking. Why? Because infertility has snatched away the joy in your libido. Most women that are having infertility problem do not have libido. If they are telling you to come for lovemaking, you'll be running away. Unfortunately, you need to make love 48 hourly. So just making love 48 hourly can get you pregnant. So you cannot be in a different room, that war room where you only go to pray and fast, but you're not meeting with your partner. My sister, you're not going to have immaculate conception. You need to meet with your partner. Some of you are quarreling with your partner. There is no room for, capture this for me. There is no room for quarreling when you want to have family. You settle your quarrel before you go to your room. And there is no venue for lovemaking. You can make love in your kitchen. You can make love in your sitting room. You can make love in anywhere, in your car, anywhere. So long as you're making love, that's okay. My people, this is the only way to succeed. There is no other way. You cannot pray yourself into love. You cannot pray yourself into pregnancy if you didn't make love. No. So let's start doing the right thing. Okay, let's use this lady's cycle to teach. You have 27, 26, 20, 27, 26. So you're averaging 27, 26. So what do you need? You find the average. You add 27 to 26 and 30, you find the average. That will be your tentative cycle. Then you apply factor 14. Very, very, very simple. Now, you are asking if you're ovulating. This is not a test of ovulating. If you attended our ovulation bootcamp, we ask you to see a doctor. So the only way for us to confirm if you're ovulating or not is to see a doctor, a gynecologist. There are specific tests we have to run. So stop speculating. Stop, punishing yourself by thinking. Some women won't even run pregnancy tests. They will, doc, I'm thinking I'm pregnant. My breast is heavy. Your breast can be heavy when you're ovulating. Your breast can be heavy when you're not pregnant. Your breast can be heavy when you're bleeding. So your breast being heavy and feeling that you're pregnant is not the right thing to do. You go and run your pregnancy test. You don't feel. Pregnancy is all or none. It's either you're pregnant or not. And it hurts. There are some women that cry every month when they see their period. I understand. But when you're done crying, you pick yourself up. You cannot become pregnant by just saying amen. You cannot become pregnant by showing up and claiming all the positive things, but you're not dealing with your reality. The problem we have, especially my people in Nigeria, some of us are in denial. Some of us are comfortable in our infertility. You cannot find a comfort zone on your infertility, and you're going to become, no, because your infertility is a danger. Your infertility is a monster. We have to confront infertility, and we have to snatch away our babies from infertility. So many couples are quarreling today. The days you're quarreling might be the day you become pregnant. That day you refuse to sleep in that room might be the only chance you have in that month to become pregnant. So forget about your worries. If you have a moment and think, most of the things we quarrel about, most of the things that couple quarrel about is words, especially women. Some women are flippant. They open their mouth, they say a lot of things. And men on the other side, they might not really be able to say a lot. You're processing a lot of things on the inside. But my people, if we are looking for babies, we don't have time. The biggest priority in your family, if you want to start your family, is your family. It's not your job. It's not your money. So many men are pursuing money. At the end of the day, they will get the money. They will buy cars. They will build big houses. But they have not funded the infertility. They have not provided money to go for the best. And this is Ember month. By the time today ends, tomorrow is 1st September. What will you do when everybody is showing up? Are you going to start regretting? Are you going to start comparing yourself with your friends, with your colleagues? Have you done what they did? The women you're reading their testimonies, have you asked them what they did? Or are you just saying, I'm claiming twins, I'm claiming triplets, I'm claiming quadruplets? Meanwhile, we don't know what the problem is. If you are believing God to be a mother, a father, and you don't have a fertility specialist by September, my sister, you're part of the problem. And we cannot accept no money as an excuse. Do you know why? You are always going to have money problems. We are always going to have challenges, but they should not stop us. Money should not stop us from starting our family, my people. Go and have a family meeting. Go and think about your helpers. If you are a good person, believe me, in this group, there are so many women that became pregnant and had their babies, and they didn't even know the people that helped them. There are so many women that come together every month and sponsor other women. These women are looking for babies themselves, but they forgo their own baby looking quest. And they contributed money to help women that are strangers have their family. Now, let me tell you the truth. There is no way in this our world you will help somebody and God will not help you. As I'm talking to you, all the women that have rallied to help women in this group, they broke the backbone of infertility. Some of them are going for their IVF. Some of them have to go back to Nigeria to become. But nothing can stop you when you give. Nothing can stop you when you step out of your own need and you step into the need of a stranger. Everything we do in this group is labor of love. I've been talking to you guys for just about 1 hour now. It's called love. Go and find somebody to love. Go and find somebody to solve their problems. In solving some other person's problem, you are getting your double blessing. There is absolutely no way you will put in baby making blessing and you won't get your own babies. Quote me anytime. But you must do something. Okay? All right. Okay. Doc, what causes period to become slippery and stretchy? Now, I'm trying to figure out what you mean by this, right? Now, ordinarily, you don't go about checking your period to know if it's stretchy or slippery. It's just probably mucus. Now, your period comprises of 3 things. The blood, some tissues, and mucus. So mucus is part of your bleeding. Now, if you are concerned that what you're noticing is not what you normally notice, ring your doctor and we can figure out what's going on. Okay, guys, admin, please, have I attended to all the questions? If I have not, please put them on the screen. Make sure at least Dr. Ndichie is attending to them. Okay? If you need to talk to me one-on-one, I'm not a stranger, okay? I'm easily approachable. I'm the best, fighter you can have out there when it comes to infertility. If you want to defeat infertility, I'm your guy. You can call me Triple Doc. We have recommended the best fertility specialists all over the world. We have looked in fertility eyeball to eyeball since 2015. We have helped millions to become parents today. So I'm not bullied. I'm personally sick and tired of seeing mothers cry, of seeing fathers cry, simply because of knowledge. It's time to take charge. It's time to take over. Your babies are waiting for you. Your womb is crying. Your ovaries are shouting. Your babies are calling you, Mom, what are you waiting for? Dad, what are you waiting for? Prioritize your infertility. Budget money, save, do it. If you need to borrow, borrow. Some people, you might not even know that your organization can sponsor your IVF. Your church people can sponsor your IVF. Your pastor can sponsor your IVF. A few days ago, I was watching one of the videos of a pastor that had an altar call, about prostitutes in the church. And he gave them countdown to 10, that all the prostitutes in the church should come out, which I believe personally, that's invasion of their privacy, if you ask me. You don't go shaming people because you want to help them. That's me. There are certain things that should be done in the secret. The fact he was calling people to come out openly, that they were prostitutes and stuff, and openly they were giving them money, I took the good aspect of what he did. The fact he called them out, I think about 14 of them, and they gave them 400,000 to go and start business. It's a good thing, but it could have been done in the secret. So why am I saying this? Your church is a very big place you can get help. Giving you Bible verse, giving you olive oil, giving you all those promises all over the world, calling you every Sunday to be praying for you is not enough. You need money. Your pastors are very rich. They are billionaires. So when you go to church, again, tomorrow is Wednesday. Some of you might go for midweek service. You have been paying your tithes. You have been putting money in the offertory every day you go to church. It's time for people to help you. If your church is 1,000 congregation, the 1,000 congregation can contribute 1,000 naira, and they can power your IVF. They should stop using you as a prayer point. Look, I'm keeping it real. Okay? You okay now? What do you need? Okay. So we need to get it right. There is no time. So when you go to your church, have meaningful conversation with your pastor. Tell your pastor that Dr. Chudi said that he's a great guy. We thank God for all the Bible verses, all the prayers, all the olive oil, all the fasting. We love God. We thank God for that. But ask them for help financially. My people, unfortunately, fertility treatment is expensive. If you're going for IVF, join me later this afternoon. We're going to talk about the cost. You need money. If your uncle is fond of always asking, hey, Ngozi, it's 5 years now. What are you doing? Where is my this? Where is my that? Call your uncle outside. Politely tell your uncle, I don't have money. Uncle, I need money. Look, if you don't, where I'm from, I'm going to use Igbo adage. So if you don't tell people what your priorities are, they will assume. Some of you might be smiling from ear to ear, and they will think the word is enough for you, but you're not happy. You go to your work, you'll be wondering why you're so sad. When you see other people and their babies, you're sad. What are you going to do about it? Have you had conversation with your organization? Have you actually thought about how you're going to get this money? Because you need the money. So change the way you pray. Some of us block our blessings. When you pray, money is the root of all evil. I bind and cast, and you're binding and casting money. You need to go and solve your problems. Money is not the root of all evil. Everybody needs money. Believe me. So let people not deceive you. Your pastors need money. That's why they drive in big cars. That's why they have security. They have their own families. So don't be deceived. Don't go and wear your Christianity and your religiosity on your shoulders and you're not doing the right things. At the end of the day, nobody's going to sleep your sleep. Nobody's going to feel your pain. You're going to be the only person feeling your pain. So do something today. I'm challenging you. As you are getting ready to enter September, decide today what you're going to do differently. If you need help, I can personally help you. Thank God I've practiced in Nigeria. I have goodwill. I have few good guys, few verified guys I can exchange ideas. Because the problem we have is this. Everybody in Nigeria is feeling like the king. We no longer listen to help. We no longer listen to understand. So when you go to your doctor, some of them, there are some good doctors out there. Some of them will think they are doing you a favor. They're not doing you a favor. If you don't go to the doctors, the doctor will go poor. So it's your right to be treated properly. So thankfully, I have few doctors I can correspond with. We can call, we can discuss, and we can co-manage. And you can be happy. We've done it severally. So I'm personally not happy. There are some women I still see around our group since 2015, my sister, and you don't have your own baby. I'm not happy about that. No. I don't want you to show up in this group next year. Please, I want you to show up with your babies and your testimony so that you can be like other people. This is my genuine prayer for you. Okay, let's wrap up. 4 more minutes. So admin. Okay, so this lady, you haven't seen your period for 6 months. Now, I want to know your age. Your age is very, very important to me. If you're above 35 or if you're tending towards 40 and you haven't seen your period for 6 months, I'm worried. You have amenorrhea. You need to quickly go and see a fertility specialist immediately. We need to check your ovarian egg reserve. We need to run all the investigations. We need to make sure you're not premenopausal. So this is not the time to be waiting. I'm coming, I'm going, and I was going, and I was coming. So many women might not even know their status. So many women might not even have eggs. You might only have 4 eggs. Now, let me ask you this personal question. I hope you understand where I'm coming from. What will you do if you only have 4 eggs remaining before you go into menopause? What will you do? Knowing fully well that God has the possibility of multiplying your eggs, especially when you're older than 35. What will you do? Will you still be praying for Jericho to come? No, you take your bold step. So my sister, as we are stepping into September, make it a September to remember. I want to hear the cry of your baby in your home. Before I go, I normally ask us to put our faith together and pronounce what we want. Now, the definition of faith in our group is the evidence of the babies we will have in 2022. The substance of our family being complete. So please, can you submit the names of your babies in 2022? You need to name your babies. If you haven't named them, you name them now. If you're believing God for twins, you name them. You put the names on them. You begin to see them. You begin to envisage them. This is how to overcome. So please, before I go, quickly put the names of your babies on the screen. We're going to pray together, and we're going to hand over the upcoming month into God's hands. If you're a member of this group, we're very small people, but we're loving people. We love each other. I love you guys, and I want the best for you. Now, please, stop sitting on the fence. Come forth. Ask for help. You're going to get help. You're going to be happy. Because when God gave you a womb, God gave you a womb to carry your baby. God doesn't make mistakes. When God gave you your breast was not given to you because you want to be sexy. No. Sexy is just a tertiary component. The essence of giving you your breast is not even for your husband. It's for your baby. God doesn't make mistakes. God would have made you a man. But you're not a man. You're a mother. Okay? So put the names of your babies. Please follow my words. I might not be your regular pastor. Believe me, I don't even want to be. But I keep it real. Now, let me tell you what has been happening. Somehow, I don't know. But when I say things, it happens. I don't know. Somehow, it happens. So I'm telling you today that your joy is coming. I'm telling you today that suddenly, when you take your bold step, there is a condition. The condition of you overcoming infertility is to accept your reality. Suddenly, infertility of 15 years, 10 years, 5 years can end. And when it's ending, it will end with double joy. There are so many people that will have twins, triplets, quadruplets in this group. Suddenly, your boy, girl you want, you have 2 of them each. Suddenly, the people that were calling you names will start looking for invitation to come for your baby shower. Suddenly, your house, you're complaining, is so quiet. Everybody is going all over the place. You've seen the number of times I've called the mentor. I'm home with him today. This is called faith. I remember when I prayed for Dumeja. I remember when I prayed for Zara. They are both here. This is actually the reason why I show up. It's made me a better person. So there is nothing before God and man who made me that will stop you from overcoming. So if you used to think that this is your regular everyday group, you're mistaken. This is a group with a difference. We run on God, we trust on God, and we know that God will become God. So put the names of your babies and cry no more. But when you go home today, share this video with your partner. Tell your partner that Dr. Chudi said it's time to come on board. If your partner has not gone for his seminal fluid analysis, tell your partner that Dr. Chudi said he's not man enough. A real man will attend our clinic every day. A real man will stick with the woman through the difficult times. You see, when you go to take your vow, when you go for your societal wedding, you do your wine carry, you do your church wedding to impress everybody. Some of you will even spend your money you will use to start your family. You spend millions to go for a wedding. But when you now marry, you begin to struggle. And if there is anything that scatters relationship, it's money. The biggest problem in the family is money. So when you use your money to impress people, to make sure that everybody's happy, but you don't have money to start your own family, you're deceiving yourself. Yeah, I'm coming in now. Just give me 1 minute, okay? So let's together join our efforts to become who God says he will become. Now, Father, thank you so much for all these beautiful babies we've submitted to you for the month of August. And together, in faith, in confidence, in remembrance, in assurance, in reminding you of the promises you made to us, that you're going to make us fathers and mothers of all nations. I commit all these babies into your care. By this time, 2022 is going to be complete. So thank you for coming. Thank you so much. And I'll see you guys tomorrow. God bless you, and jump into your September and make it a September to remember. God bless you.